One of my real passions is African rhinoplasty, or rhinoplasty for the gentleman or woman of African descent. So African rhinoplasty, or rhinoplasty for the African patient, is very unique in the sense that the African nose, which is known as a platyrhine nose, is a different type of nose from the mesorrhine or leptorrhine. Mesorrhine being more Asian, leptorrhine being more Caucasian. Everyone knows that it looks different, but how does it look different? So a few of the salient points of African nose, besides the darker skin complexion, is that the nose is typically broader on the top portion, the nostrils are more flared, and the tip is a little bit thicker skin and a little bit flatter and broader. So what I'm trying to do with an African rhinoplasty is not make it white, it's to make it less ethnic. So if you think about standards, even white noses are not white in the sense that they also have broader tips, they have broader cartilage, they want a finer looking nose. And so what I'm trying to achieve is a finer looking nose that's more aesthetically attractive, and one where when you look at the person, you don't look at the nose as a dominant feature, but you look at the beauty of the eyes. And I encourage you to watch some of my other videos where I explain that a little bit better, and definitely watch my ethnic rhinoplasty where I talk more about specifically how I perform the procedure and the specific techniques of doing it, which this will not cover exactly. I will cover some of the basic ideas. So let's talk sort of break down the African nose into top, middle, and sides. One of the big things is balance. So balanced rhinoplasty means a bridge is not the dominant feature, the tip is not the dominant feature, and the sides are not the dominant feature. If you look at my African American rhinoplasty or just African rhinoplasty results, you'll see I have all different types. I've got a hanging tip, I've got a tip that's upturned too much, I've got a tip that's too broad. So there's so much variability that for me to cover every permutation of the African nose is like talking about every permutation of rhinoplasty that exists, and you'd be sitting here for hours, you'd probably fall asleep. So my goal is not to talk about every type of African rhinoplasty, but to talk about the basic features and how I generally manage it. And again, I encourage you to watch the Ethnic Rhinoplasty virtual consult for more specific details. So the bridge area, what I oftentimes do to make it look better is I raise the bridge. The reason now, not all the time, sometimes I lower the bridge, sometimes I lower and raise the bridge. And certain areas need to be lowered, some areas to be raised. But in general, I oftentimes raise the bridge because when you raise the bridge, it does two things. It makes the nose look narrower, because think about the top of a peak like this. When it's raised a little bit, it looks narrower. The second thing it does is it makes the tip look smaller. If you think about the analogy that I always use, which is if you think of a glass of water on a television screen, I put a shot glass next to it, the original glass of water now looks large. If I put a pitcher of water next to it, the original glass of water looks small. So by raising the bridge, not only does it make it look narrower, but it also makes the tip look smaller, even if I haven't even done the tip yet. The other thing I oftentimes do is what are called lateral osteotomies or refining osteotomies. Osteotomies basically mean sort of breaking that bone outside there to narrow the bridge a little bit. I don't do the middle one because it destabilizes the area that I've raised, but it just creates a little bit more refinement. When do I not do that? When the tip is too broad, and even though I narrow it, I still can't quite narrow it enough. If you over narrow the bridge, you get the exact opposite problem. It's like making that shot glass next to the glass. All of a sudden this looks bigger. So if I over narrow the sides, your tip will look too large. And so it all depends on the tip size and shape for me to decide whether to do those refining osteotomies. They don't really add too much recovery. They don't add too much discomfort at all. It's just one of those things that is a question of whether it's going to help you or hurt you. From the tip perspective, again, I'm not going to talk a lot about lateral turn-in flaps, extended caudal septal extension grafts, all those things, nasal sill reductions. Those are going to be really my ethnic rhinoplasty video. But the goal with the African tip is not to make too much projection coming out, not overly pinch it, create still a natural curvature that looks good. And oftentimes, I would say 80%, 85% of the time, or maybe more, I'm reducing the nostrils a little bit. Listen to my ethnic rhinoplasty video, how I oftentimes do it. The vast majority, I'm doing just a simple nasal sill reduction to minimize the visibility of scarring in here. I try to avoid the outside incisions because it can lead to a prolonged recovery time and possibly minor scar visibility when someone's up close to you. I will do that in select cases when I don't think I'm getting the level of refinement there, but of course I do that very judiciously and very discreetly. And so the idea is ethnic preservation, even though it's truly enhancing and making the nose look more attractive. And also, it's really about ethnic preservation and also just a natural nose that fits your face.